think what we've learned in the United States is the complexity of relationships and how research should inform practice. In the United States, it's quite interesting. We're seeing a plateau in the prevalence of obesity in women and girls, but not in men and boys. And severe obesity in the United States is getting worse. We need more innovative strategies, more innovative care delivery systems, because the model that we have of provider-patient interaction is an archaic model. It was well suited for the treatment of acute infections or injuries, but very poorly suited for the prevention and treatment of chronic diseases. In order to change the way we deliver care, we really need to change the system of care. And to change the system of care, we need to change the educational format. So that, for example, currently the educational system defines the qualifications or the abilities of a provider, when in fact it should be the needs of the system that shape the provider credentials and qualifications. And when we begin to think in those terms, we need to think about how a provider needs to open the conversation about obesity. We're not training providers to use the right terms when talking to patients. Obesity, for example, is a pejorative term when it comes to the discussions of weight, whereas overweight or unhealthy weight or elevated BMI are much more acceptable and open the conversation. We also need to have better reliance on other professionals, other care extenders, because physicians are poorly suited to the delivery of this care. We are not trained in behavior change techniques, and techniques like motivational interviewing, which others have mentioned in this conference, is a very sound technique. Interestingly enough, few providers are trained in motivational interviewing, and although we don't know whether motivational interviewing itself improves care, we do know that it opens a conversation and is a patient-centric strategy rather than a physician-centric strategy. There's several important relationships and alliances. The first is within medical systems, with allied health professionals, nurse practitioners, and providers establishing the appropriate mechanism for care and who does what. But the broader context of alliances is equally important, because coming back to the original theme of this complementarity of medicine and public health, we know that providers can't succeed unless the environment to which their patients return reinforces the kind of strategies that they're trying to achieve. So we need to be thinking about, from the government side, in terms of health in all policies, health and transportation policies, health in schools, health in work sites, health in communities that foster these kinds of behavior change strategies, or I should say reinforce these behavior change strategies. Within the broader community, in terms of alliances in the United States, one of the interesting phenomena is that we're seeing this kind of multi-sectoral collaboration around obesity prevention and control. So one alliance, for example, is focusing on how do we increase demand for more healthful products. A second is focusing on how do we increase physical activity in out-of-school programs. And in that one, which I'm part of, we're developing alliances with groups like the Boys and Girls Club, the YMCA, Boy Scouts, Girl Scouts, to put in place three very simple strategies. Drink water instead of sugar drinks, use fruits and vegetables for snacks, and increase physical activity levels. And that in the United States is likely to have a profound effect on millions of children who are in these programs. It's not clear how successful we're going to be, but what's interesting is that related to the plateau that we've already seen, we can begin to align that with changes in consumption, because we know that consumption of sugar drinks and fast foods has decreased. We also know that companies are marketing more healthful products. They're seeing the greatest growth in their healthful foods, and the greatest revenue is coming from those products. And we see the same thing in restaurants. So we're starting to see an alignment of the food system with the weight plateaus. Those plateaus are just that. They're not a reversal of the epidemic, but it suggests that we may be at the corner where we can begin to reduce the epidemic.